organization or service represented in this video should not be considered as endorsed or recommended by Texas A&M AgriLife Extension Service. Thank you for joining us again for another episode of Insurance for Seniors with the Harris County Office of Texas A&M AgriLife Extension. In this episode, we'll be going beyond Medicare basics to talk about some specifics of Medicare and Medicare Advantage and how to make the best choice for your health insurance coverage. I'm your host, Cindy George. I'm a master's in public health student at the University of Texas Health Science Center at Houston School of Public Health. Today, our two guests are Anthony Holmes. He is a sales manager for the Houston, Beaumont, Galveston territory for WellCare, and he is an expert in Medicare and Medicare Advantage plans. Our other guest is Ms. Rose Ortega. She is a certified benefits counselor and information and referral specialist for the Harris County Area Agency on Aging. She has been advising Medicare enrollees for 28 years in English and Spanish. Also, we are joined by Dr. Sonja Stewart Davis. She is the Family and Community Health Agent for Harris County, Texas A&M AgriLife Extension. And we are joined by Ms. Carrie Calloway, the Community Engagement Coordinator for that office. In this conversation about Medicare, we hope to provide information to our elders, their caregivers, and anyone who handles their business. Welcome, Anthony and Ms. Ortega.
Thanks for having me.
Thank you for being here. Let's jump back in to where we left off with Medicare basics. There are two options, main options, for you to consider when enrolling in Medicare for most people who are turning 65 or have turned 65. That would be Original Medicare Part A and B, or replacing Part A and B with a Part C Medicare Advantage plan. What we want to do in this episode, going beyond basics, we want to talk about how someone can make the best decision about which main option is best for them, either going with Parts A and B or going with Part C, a Medicare Advantage plan, which is a private plan. So who would like to start with how you advise people to make the best basic decision about which direction to go for Medicare?
I'll start. It's on an individual basis. A lot of times what's right for one person just isn't right for the next. So you have to do a needs analysis and talk to this person about what they expect for their healthcare needs for the year. And we know insurance is for the unforeseeable, but they have to estimate and kind of, guesstimate based on their history about what they can expect going forward. What kind of out-of-pocket expenses, how many times do they think they'll go to the doctor? What are they dealing with currently? How many specialists do they have? Are they having a lot of procedures? Do they anticipate being stuck in the hospital? And if that's the case, if we've got, maybe for instance, somebody who's a cancer patient or somebody who's going to a lot of doctor's appointments and spending a lot of money out of pocket month to month on their healthcare, then that person may lean towards a Medicare supplement if they can afford it. So Medicare supplements do have a premium monthly, but they're going to cause a person to have much less out-of-pocket exposure when something happens to them. Where a Medicare Advantage plan is going to have no premium or a very small premium, and then you pay co-pays and things of that sort when something happens to you. But those co-pays are controlled. You know what they are. You can expect and prepare yourself to pay those co-pays because you know exactly what they are when something may happen to you. So it's just based on the individual and what that individual can afford and what that individual's healthcare needs are. They're a little bit more on the healthier side. A lot of times a Medicare Advantage plan is right for them. based off the fact that, they're not having a lot of specialist visits and not having a lot of out-of-pocket exposure. So that person can save month to month on premiums by just selecting a Medicare Advantage plan and paying the co-pays associated with that plan. So again, it's really based on the individual.
And when you say zero premium, you're saying no premium in addition to the Part B, because regardless of whether you choose original Medicare or Medicare Advantage, you still are responsible for that Part B premium.
That's absolutely right. So the Medicare Advantage plan itself has no additional premium, but you're right. When you sign up for a Medicare Advantage plan, you are responsible for continuing to pay your Part B premium. That's correct.
And Ms. Ortega, how do you help your people that you advise sort this out to make the best decision for them?
Well, again, just like Anthony mentioned, considering their needs, their out-of-pocket expenses, their current health, and what they plan to do. Sometimes our Medicare beneficiaries that are planning to retire, um, they're pretty healthy and they plan to travel. So if that's the case, again, I explain both options, their choices, which is the original Medicare option, and then the option 2, which is a Medicare Advantage plan. And I let them know that Medicare, original Medicare, it's acceptable nationwide. If they do plan to do that option, then also tell them they need to consider a separate prescription drug plan. And then also they may want to add a Medicare supplement insurance to cover those gaps that Medicare doesn't cover. Because again, I tell them and explain to them that original Medicare covers 80% and they'll be responsible for that 20% no matter where they go in the United States. If they choose a Medicare Advantage plan, some of them may choose that option because of the extra value benefits that an Advantage plan offers. Now, I do explain Medicare does not cover dental, vision, and hearing, but the Advantage plans, they offer their members these extra value benefits. So if they're interested and they like those choices, then I go ahead and explain that option for them, which is also known as Part C. And again, I carefully explain both options depending what they can afford or what they need. And then also, I also let them know that because sometimes they get confused and they think, what happens if I can't take care of myself? Does Medicare cover in case I need to go to the nursing home? Does Medicare take care of me if I need help in the home? So I explained that in the beginning, Medicare does not cover long-term care. And then I go into other details about that as well.
Okay. And so, Anthony, you have encountered sticky points with some of the people that you have advised. Talk about the lack of knowledge that you have encountered when people are approaching 64 and trying to make that decision about what kind of Medicare coverage to get.
Absolutely. Well, I'm forced to take a bunch of certifications and tests annually to keep me up to date with Medicare, but unfortunately, a lot of the public just doesn't do that. And so when they turn 64, a lot of times they're just a little undereducated and they don't quite know what to expect with Medicare. But that's where somebody like myself comes into play, and we can get you educated on the things that you may not know or that you might have been misinformed about. So it happens quite often, and a lot of times it's not anything malicious, but there's just a lot of information to know about Medicare, and the average person just doesn't quite have it all the way together. But we definitely have the tools and the resources to get them what they need and get them caught up to speed and educated on exactly what they need and exactly what their options are and exactly what'll fit their particular needs most effectively for them. And that's pretty much what we run into.
So also you encounter lots of people that have wrong information. They picked up something that just is inaccurate regarding Medicare. Can you talk about some of the misnomers you've heard presented to you?
Well, a lot of times, people don't sign up for Part B because they feel like it's too expensive, and maybe they don't know that they qualify for help. They don't know that they qualify for uh, Medicare Advantage plans that may give a Part B give back and things of that nature. So it's just kind of a negative connotation sometimes that's associated with Medicare, that kind of causes them to, like you said, the misnomers and the miseducation to kind of set in and cause issues sometimes when they finally get the right information. Sometimes it's too late and they've already incurred penalties and things of that nature, and it becomes even more expensive at that point to take advantage of Part B once you have the proper information. So I just encourage everybody to start out ahead of time, getting the right information and doing the proper research and talking to somebody that can give you the right information and put you on the right path to taking advantage of everything that Medicare has to offer for you.
And Ms. Ortega, you wanted to chime in?
Yes, when I explain the options, and I go into, let's say, a Medicare Advantage plan, sometimes consumers may say, I want to keep my doctor. Well, I tell them, have a conversation with that doctor. Ask them what plans they accept. Do they accept original Medicare? Do they accept any of the Medicare Advantage plans that are available? And sometimes I'll give them those names of those companies that are out there that are contracted by Medicare. And then also explain the options under a Medicare Advantage plan. I'll explain what an HMO is. I'll explain what a PPO is. I'll explain the difference. I'll tell them, what, under an HMO, you must use providers within the network. And then, so I tell them you got to check your doctors before changing plans to make sure that they're in that network provider. And then also I explain that most HMO plans will not charge you an additional premium to what they're already paying for Part B. And then also let them know if about PPOs, they can use providers that are either in the network or outside of the network. But of course, it's a savings if you stayed in the network, but that out of the network option is available. And then also we'll tell them that a PPO, some plans may charge an additional premium.
So let's go to slide 3, because one sticky point for a lot of people is most people who are covered by Medicare are age 65 and older, but slide 3, there are some people who will qualify for Medicare outside of age 65 and over. Can we talk about circumstances that would make you Medicare eligible and you are not 65 years old? Anthony?
Sure. So anyone who qualifies for Social Security disability income, and they have that, they're receiving that income for 24 months or more, they're going to qualify automatically for Medicare, and that has no age limit. So anybody that's an adult that receives that SSDI for 24 months or more, they qualify automatically for Medicare. There's also a couple of health situations that a person could be in that will qualify them as well. If a person has end-stage renal disease or kidney failure that requires them to have dialysis, or ALS or Lou Gehrig's disease, then those folks also qualify for Medicare as well. So not everybody is 65 or older. Some folks, unfortunately, qualify sooner than that based off of disabilities or healthcare situations.
And those disabilities can include mental health conditions.
That's a very common one among younger folks that qualify for Medicare. A lot of VA, a lot of veterans are going to qualify young due to mental situations. So yes, that is a very popular reason why people qualify for the SSDI benefits at a young age, for sure.
So let's go to slide 5, because in addition to knowing when in your lifespan you need to make some decisions about Medicare. There are certain times during the year, once you are enrolled in either Original Medicare or Medicare Advantage, that you need to be aware of when to jump in and when you can make changes, either going from an Advantage plan back to Original Medicare, going from Original Medicare to an Advantage plan, or switching between Advantage plans. So let's go through this slide, Anthony and Ms. Ortega, regarding enrollment.
Sure. So we talked in detail about the first one that you see there, the initial coverage enrollment period that lasts for 7 months, starting 3 months before the month of your birthday or the month that you turn 65. I'm sorry, or the month that you become eligible for Medicare Part A and Part B. Something like we just talked about, sometimes it's sooner than your 65th birthday. And then the 3 months that follow that month that you become eligible for Medicare as well. Then you have the annual enrollment period, which lasts from October 15th through December 7th, once a year. Anybody that's qualified for Medicare can make changes and evaluate their situation throughout this time frame. So you see a lot of people evaluating their prescription drug plan to make sure that there's not another option that will provide them with a lower out-of-pocket cost for the year for their medicine. Some folks just like to see if the medical benefits on other plans have improved, whether it be copays. A lot of the people that I talk to like to see what the added benefits are. They want to see if we're doing more for dental or doing more for hearing, vision, things of that nature. This year, the big thing is grocery. Folks are getting, we're having a lot of competition with who can provide the most grocery to people month to month this year. So there's a lot of reasons why people like to evaluate, but no matter what your situation is, as long as you have Medicare, this is the time frame where you can evaluate and make changes to not only just your Medicare Advantage plan option, but your standalone prescription drug plan as well.
And these dates remain the same regardless of the year.
Say that one more time. I'm sorry.
These dates are the same year to year. October 15th to December 7th is the window.
Absolutely right. That's right.
And Ms.
That's right.
What do you tell people about the annual election period at the end of the year? Some people call it annual enrollment for Medicare.
Yes, this is the time that we become very, very extremely busy. People want to change, or they want to know, what plans are going to become available for next year. So they want to know if there are any changes in their current plan, and if there are, again, any new options that are coming in for the following year. So this is the time that they need to review their plans, look for changes. Are their primary care physician changes? Are any of their doctors, any providers changing? Is their pharmacy changing? Their hospital choices changing? All those things is very, if they're very important for that consumer. They want to know, I want to know if these things are changing for next year. So Medicare provides this annual enrollment period, and just like it says, October 15th through December the 7th. Any of the choices that they change during that time will be effective January 1st. Okay, so if they enroll, people have in their initial enrollment period, and then they have that special enrollment period. So if their initial enrollment period has passed, and again, if they're still working, they have that special enrollment period to consider Medicare.
And then also, one thing about the timing during the year, around September, you should receive an annual notice of coverage that people call an ANOC that will let you know what those changes are in the upcoming year. Anthony, can you talk about the ANOC?
Yeah, so we do send out that ANOC. Normally ours go out about 60 days prior to the 15th of October. I'm sorry, not 60, 45, right at the beginning of September. They normally go out. So about 45 days before the annual enrollment season starts, we get our new information. It's finalized on that day. And so we send out that letter and give everybody, it's a chance for them to look at the changes and decide whether or not they want to use that election period to make a change, or at least see what else is out there based on how happy they are about what they see in that letter. that they receive. So it does go out once a year and let them know what's changed for the good or for the bad, and give them an opportunity to decide what they want to do when the election period rolls around on the 15th of October.
You also have the option to take no action and keep your current plan.
Absolutely right. Absolutely right.
And then
Sometimes that's what we hope. They get good news on the ANOC and want to keep the plan.
and also, it's important to have your contact information confirmed and updated with your Medicare plan or original Medicare during this time so that you receive that notice.
No doubt. We get a lot of people that are really upset with us because they are blindsided by changes, and we have to ask them, well, hey, did you get your the annual notice of change letter in the mail? You should have received that back in September. And a lot of times people don't open the mail, or they got the wrong address on file and things of that nature. So we have to help them out with making the proper changes. But you're right that sometimes people do slip through the cracks for sure.
And then, Ms. Ortega, what do you tell people as they're moving into a new calendar year regarding their changes that can be made to Medicare Advantage during the open enrollment period?
Um, you know, we tell them this is the time for them to consider and look and see if there are any new options out there. Is their current company offering a new plan? And then also ratings. These companies receive a rating. So Medicare is listening to their concerns, their complaints from the consumer, from the providers. So they get ratings. They get from a 4 rating up to a 5-star rating. So we're fortunate that here in Harris County, we have some plans that have received a 5-star rating, and they've maintained that 5-star rating. So again, if they're not happy with their plan, they have the annual enrollment period to make those changes, or they may qualify under a special enrollment period rating or a Medicare Advantage plan. So let's say they made a choice during the annual enrollment period and we're already in the new year. They find out that their doctor is no longer accepting that plan. So again, we counsel them, we check and see if they qualify for these special enrollment periods, and we'll help them out make those changes. And that's the difference between us and, some of the Medicare Advantage plan and being certified as a benefits counselor. There's an open door. There's no, you know, not to worry, not panic. We'll listen to them, and again, we'll review their choices with them.
So I want to make sure that I correctly identify the ANOC. It's the annual notice of change that you should receive around September about what's changing in those plans. One question: if you have Medicare Advantage and you want to return to original Medicare, you can only do that January to March. Is that correct?
No. No.
Go ahead.
They can do it during the annual enrollment period. If they choose not to no longer stay with original Medicare, that Advantage plan, they can make that choice during the annual enrollment period. But we tell them they have to remember to select a Medicare prescription drug plan as well, because a lot of times they'll cancel that Advantage plan but forget to enroll in a prescription drug plan. If they do make that change, let's say they do, one way to do it is once they look at the plan and enroll in a prescription drug plan by itself, that automatically cancels their Medicare Advantage plan. And again, as I stated before, any changes they make during the annual enrollment period, that change becomes effective January 1st.
Okay. And so to wrap up this episode about some specifics of Medicare and Medicare Advantage, is there anything you want to say before we ask you to give your contact information?
No, I think we covered it all. I think we covered it all today.
Well, I really appreciate both of you. Ms. Ortega.
Yes, I like to tell people that to renew that annual notice. It's very important. And also, they're welcome to give us a call. We do have certified benefits counselors here at the Area Agency on Aging, because a lot of times the information they get in the mail, they forget to open it up, or it's overwhelming, and they just need to speak to someone. So we're here locally. We talk to people over the phone. We also have an option for they can schedule an appointment, see us in person. They can receive one-to-one benefits counseling session.
And I think one thing people also aren't ready for when they get close to 65, there are many companies that sell Medicare Advantage plans. So you might get information from WellCare, but you might get information from a lot of other names that we know. In the mail, you'll see the television commercials escalate, and you have a lot of options.
That's true. That is true. There's a lot of options, and unfortunately, there's no way for us to control that. Once a person becomes eligible for Medicare or is becoming eligible for Medicare, I mean, you'll get unsolicited Medicare-related mail, and you'll forever be seeing television commercials, and now with celebrities on there, talking about, these, Medicare Advantage plans, which they're great. Believe me, they are great. But again, it's overwhelming for folks, Medicare beneficiaries who are older. It's overwhelming for them. For the ones who are younger, not so much, but they still have questions. So again, we're here and available for them.
And that's why it's important to do a couple of things that we've reviewed today, that you need to start early, and then you need to talk to people you can trust, like Mr. Holmes and Ms. Ortega, to help you navigate through a lot of this information, because it's not just what you'll get in the mail or on TV. There are billboards, there might be literature where you're going to your senior center, that kind of thing, at your faith community. It's going to be a bombardment of information. And so you're going to need to potentially find someone to help you sift through all that. And that's why we're having this webinar, to give you some signposts on where to go to help you figure it all out. So, Mr. Holmes, how do the people reach you at WellCare if they want to reach out and talk to you?
You can reach me by cell phone 24 hours a day. If I don't answer and you leave a message, I'll get back to you. You can reach me at 214-695-5371. Again, that's 214-695-5371. Call anytime.
Thank you so much. And Ms. Ortega at the Harris County Area Agency on Aging, how do the people reach you?
Okay, so we have our call center here at 9250 Kirby Drive here in Houston, Texas. They can reach us at 832-393-4301. That's our local office here at the call center. They can send us an email. It's aging@houstontx.gov.
Thank you both for joining us and providing this very valuable and robust information about Medicare and Medicare Advantage. We are here to have these insurance for seniors conversation for our elders, their caregivers, and anyone who handles their business. We thank you for joining us and hope this has been helpful to you. Any organization or service represented in this video should not be considered as endorsed or recommended by Texas A&M AgriLife Extension Service.